now we will have David Balmer to Panama City Beach Rotary Club to introduce our guest speaker.
I'm sorry, I can't follow that. I just can't.
Thank you, David.
Yes, you can, David.
Oh my God. Well, today's topic, obviously enough, is about COVID-19. It's important that we have an update because there's a lot of information going on out there that challenges us a little bit as to what's true, what's not true, and in particular, what are they doing with the positive, who is actually getting positive about this, what are some of the positive results, what's going on with testing, and what we need to know to protect you and our families from this disease, although Neil has given us a good suggestion already. Our speaker is the Public Information Officer with Florida Health Bay County. Please give me help me give a Rotarian welcome to Heather Kretzer.
Hey.
Look at that. Applause.
Good morning. Can you guys hear me okay?
Yes.
Okay. Technical difficulties earlier in my Zoom shut down right before the meeting, so I apologize for that. I have a little PowerPoint presentation that I'll share with you guys. I don't, I'll put up here. Nice. Okay. So I know some of the stuff you guys may already be familiar with, but we'll kind of go over some of it quickly. So we'll talk about in this, how the outbreak got started, the transmission and symptoms, treatment and testing, talk about prevention and other ways to get information on COVID-19. So currently in Bay County, there are a total of 25 cases of COVID-19. We have 24 residents, non-resident. We also had one death over the weekend, a 93-year-old Bay County resident. We definitely send our condolences out to his friends and family. We've had a total of 5 hospitalizations. 341 tests have been processed, and of those, 316 have negative results. So our percent positive is at 7.3% currently for Bay County. Now, taking a look at Florida, of course, we know West Palm, Broward, Miami-Dade are really the biggest areas for cases right now. There's been a total throughout the state of 14,747 cases, with 14,302 of those being residents, with 296 deaths, 1,893 hospitalizations, and of that, they've had actually 139,669 total tests that have been processed. This is the second number. We've done more testing than any other state besides New York, and of course, New York is the epicenter of this virus currently in the world, not just in the United States. And the percent positive on the state level, it's been about 10.6%, which is what we've been seeing kind of, throughout the United States and stuff. And some of the county percent positive went into 9%. It kind of fluctuates depending on the testing, but around 10% is what is somewhat expected. The transmission symptoms, some of you guys may already be familiar with this, like I said. It spreads through respiratory droplets from an infected person when they cough or they sneeze, and that, 6 feet apart, is definitely where you want to be away from that. And it's mostly spread among those close contacts. That's people that you are within 6 feet or less over a prolonged period, which they define that prolonged period as about 15 to 20 minutes. So it's mostly going to be spread persons within your household, or, if you're sitting next to maybe at the doctor's office, or if you're at a work setting where you're sitting close to somebody for a long period of time. The symptoms appear about 2 to 14 days after exposure, and of course, as you all know, that's fever. They're looking at 100.4 degree temperature, cough, and difficulty breathing, which are those symptoms. And then we'll get into the treatment and testing. Of course, right now, there's no specific treatment for COVID-19. There is some things that are being looked at as FDA trials, and I know the governor talked about in his roundtable yesterday, making some medications available to doctors in a hospital setting. They can oversee patients that potentially may need those different kind of treatments with the malaria medications and the Z-Pack and things like that. But there's no specific approved treatment. And there's no treatment outside of, being overseen by a doctor in that hospital setting is where they're talking about using that. People who feel like they've been exposed and they have symptoms should immediately self-isolate. Testing priorities that we have from the CDC. Priority 1 is going to be our hospitalized patients and healthcare facility workers that have symptoms. And priority 2 is patients in long-term care facilities with symptoms, such as our nursing homes and our long-term care facilities. These are some of our most vulnerable populations, and it can quickly spread within those, as we saw in the Washington state area, what happened there. So that is definitely one of the big priorities across the state. We're going out and have strike teams that are going to those nursing homes, making sure that they are doing, proper things. They're following the CDC guidance for infection control and things like that. So, and then that information is shared with ACA, who oversees those facilities. People, of course, that are 65 years of age or older with symptoms would be in that priority, and patients with underlying conditions with symptoms, and then first responders. So going back a little bit to underlying conditions, what we're seeing now in many cases, do you need me to back up a little bit in my presentation? Is that what we're saying? No. Anyway, so those people with diabetes, which is a big illness. So people with diabetes is one of the biggest factors that we're seeing with some of the poor outcomes from COVID-19. Of course, people with heart disease and persons with asthma. So those are 3 of the biggest ones. So if you have diabetes, heart disease, or asthma, you should already be under that safer at home order from the governor, which we'll get to in a little bit, but you especially need to be careful with coming in contact with the virus. And of course, most people who do get sick will have mild symptoms, about 80% of the cases, and they're able to recover at home without medical care, but they should seek medical consultation from their doctor just as they normally would with any other type of illness. And those emergency warning signs, of course, would be difficulty breathing or shortness of breath, persistent pain or pressure in the chest, and new confusion or inability to arouse and bluish lips or face. And we hope, of course, people are getting emergency care before they have the bluish lips or face. That would be a big warning sign. So like we talked about a little bit earlier, stay at home if you're sick and encourage employees to stay at home. Of course, most people reporting to work should be only essential business persons, and even those essential workers, trying to get them to do telework as much as possible. I know I'm doing about 50% telework, 50% in the office right now myself. And as we talked about, many of those cases can be managed at home, and those are the emergency warning signs in a little more detail. So the prevention, and I know you guys have heard this a lot as well, of course, washing your hands with soap and water for 20 seconds, washing your hands often, or using hand sanitizer with at least 60% alcohol. Of course, a lot of people said they've had trouble finding hand sanitizer, but soap and water are really better than hand sanitizer anyway. Avoiding touching your eyes, nose, mouth, face, and anything like that, and avoiding contact with sick people. And then, of course, staying at home when you are sick. And we talked a little bit about social distancing. What that means, in terms that we can apply, especially with the governor's new order, the safer at home, and the limiting movement, is only going out for essential purposes. Is this something that you need versus something that you want? So if it's something that you need, go out, do those once-a-week trips to the pharmacy, the grocery store. If you're going out to work and you have to go to work, you're an essential employee. Staying 6 feet away from persons while you're out, that includes in the work setting. You should still, if you're still going to work in the work setting, still staying 6 feet away from people, utilizing telework when possible, and avoiding gatherings of more than 10 in social settings. So basically that's going to be in those essential settings. So even if you're still going to work, and you're having meetings maybe at work, can you do those meetings from your desk with a conference call, or limit those meetings to 10 persons or less? And then following the governor's safer at home and movement limitation orders. The CDC did recommend over the weekend that persons begin wearing cloth masks. That is not a surgical mask or N95 mask that should be reserved for medical staff. This is basically something that you can make at home. They have some great DIY instructions on their website. There's a video with the Surgeon General for the United States on it that's demonstrating that. It can be made, through cotton and sewing it, or you can literally use a bandana and then add a coffee filter in there, or use an old t-shirt. So it has some instructions on that. It's actually very simple. You just want to make sure that it's covering you, from your nose all the way down under here. Basically, what this mask is going to do is going to prevent you, if you were asymptomatic, from spreading COVID-19 to other persons. The new scientific data and research coming out suggests that there is some of that transmission taking place. I mean, it will provide some protection for yourself, but it's really helping to protect your community when you're in the grocery store and you're in the pharmacy and your other places where you may not be able to observe that 6 feet of space. And so it should not replace the social distancing measures that are already there in those governor's orders. So as you guys know, we talked about the governor's order a little bit earlier. The Safer at Home order was issued April 1st, limiting movement and personal interactions outside of the home for the next 30 days. That says effective midnight. I forgot to change that from presentation earlier, but that was of last week, last Friday. And those essential services, of course, there's the essential critical infrastructure workers, healthcare, public health, transportation, energy, financial, communications, our grocery stores. But there are some additions to that, and that information is available at floridahealthcovid19.gov. If you have any questions about whether or not you're an essential business, you can also go to floridadisaster.org, and it has a form where you can fill out to either find out if your business is essential or to request that your business be considered essential. Under the governor's order, any violations of that are directed to law enforcement, and law enforcement will be the ones to look into those, and it is a misdemeanor charge for them being open. And you can also report to Florida Department of Business and Professional Regulations, or whatever the regulatory agency is for that particular business, if you feel like there's somebody that's not, that's violating this law. Of course, earlier that public health advisory was issued on March 21st for all persons that are over 65 years of age or anybody with underlying health conditions, because as we talked about, those persons are going to be most at risk for, sorry, I have to decline that call. I hope that did not interrupt the presentation, but those persons are going to be more at risk for the more adverse effects. As we've seen, we've had 25 cases here, and we've had 5 persons that were hospitalized. So that gives you some kind of indication. Typically it's about 20%. We're seeing a little bit less than that here in our area, which is a good thing, a positive thing. But so we just want to continue to keep protecting those persons. If you have someone like that in your home, which I do, my son has asthma, so I'm making sure that we really take these precautions very seriously. If I go out, my husband goes out, we make sure we're to wash our hands very well, wipe off items and things like that whenever we're coming back in, just as an additional layer of protection for him, so before we interact with him whenever we return. Also included in that order was a density of workforce that came down from the governor and from the public health surgeon general for the state of Florida, allowing for, it said, allow as much telework as possible for employees and reducing the on-site workforce to 50% capacity. So that could mean staggering schedules, or, those that can't work from home, 50% can work from home, 50% still need to be there, whatever the case might be for those employees. And of course, now we're looking at essential employees, which does encompass a very broad scope. We have a lot of ways for people to get more information. We have our website, floridahealthcovid19.gov. That's the state's website. On there is, all the updated information and resources. You can look at for resources by specific audience. It has all those governor's orders. It has even public service resources for people if you have persons in your life or clients or employees that may need some additional types of assistance during this time. That's a great resource and tool to use. Here on the local level, we also have partnered, the Florida Department of Health and Bay County have partnered for bayhealthcovid19.com. That has information that has our Joint Information Center releases and encompasses information specifically from Bay County at that website. And of course, our website is bayfloridahealth.gov. We put our news releases and things up there. And you can also go to the main COVID website for Florida Health from that site. In addition, we have a text messaging alert service where we're sending out all of our news releases and other important information like the cloth mask information that I shared with you all earlier. If you text They Help to 888-777. You'll be signed up for those. And of course, you can follow us on Nextdoor if you're not already following us. We have the ability to reach about 27,000 persons on Nextdoor. Of course, it just depends on who's on there on the day. We're posting our releases and other information on there as well. So that kind of concludes the presentation for now, and I'll take any questions if we have time for that. I'm not sure what the format will allow for. So.
Yes, first, Heather, thank you for a outstanding presentation, to bring us up to date on what's going on with COVID-19 in Florida and in Bay County. There are some questions. First question is, how prepared is Bay County with ventilators, personal protection equipment, and bed spaces?
Well, we work closely with our hospitals, and if our hospitals have any needs, they do let us know. So we are working with them. So far, they haven't had any issues or any need requests, except for personal protective equipment, in which many of you may have saw yesterday, WJHD covered a story, Gulf Coast State College, since they are now closed and aren't doing any of their stuff on site. They were able to donate quite a bit of equipment to both of those facilities. Also, the state of Florida received a big shipment, and I can't remember the numbers off the top of my head, of personal protection equipment that's going to be distributed throughout the state of Florida. And so that'll be going to the Bay County Emergency Operations Center. And when those requests come to the Bay County Emergency Operations Center, then they will be prioritizing those requests. Right now, they're doing pretty well and haven't really let us know of anything, that they need at this time. Again, we've only had 5 hospitalizations, and we hope that, since the cases were more, down south initially, and all the social distancing measures that come into place kind of earlier for us as far as caseloads, that we're able to keep those caseloads down. But so we're definitely in constant communication with the hospitals, and should they have any needs, we will definitely be working with them to make sure that they get what they need.
And a follow-up to that question, does Bay County have an adequate number of tests?
Of testing supplies?
Yes.
At this time, yes, we are able to meet the needs for the priority 1 and priority 2 populations.
Okay. Another question, can you catch COVID-19 again? If you had it once, can you contract it a second time?
I am not sure. I have to check on that and get back to you guys. So I can send that information to Andre once I find out.
Okay. Another question is, in the News Herald, there was an article about respirators being designed and built at the Navy base. What is the status of this project?
I would have to ask the Navy base about that. I mean, I've heard some information on that, but that would be a question for the Navy base.
Okay, that's all the questions that have been sent through the messaging systems. Are there any other questions that anyone want to ask other?
Yeah, this is Larry in Tallahassee. Heather, again, thank you so much. We can never hear this too often, and especially as new information comes out. I work at Tallahassee Memorial Hospital, and we keep getting updates every single day. And an article that went out in our newspaper just on Saturday talked about the model that we're using from the University of Pennsylvania to identify when we're likely to get our peak in Tallahassee. And according to that, it looks like it'll be about a month from now. And what our CEO is projecting is that we will likely have 100 admissions a day. Are there any of those kinds of projections in the Panama City area yet about when you are likely to experience a peak?
The hospitals, of course, are working on some of their own modeling. The problem with modeling right now is there's not a good projection tool right now, because there's so many different ones and they're kind of all over the place. As of our call yesterday, it looks like we're going to be using the DOD's projection tool. And from what they said, the state of Florida's peak is going to be about April 21st.
Okay. All right. Thank you.
Hey, Heather, can you hear me?
Yes.
This is Tony Bennett. How are you?
Good. How about you?
Good. Thank you for the presentation. It's very good. My question is, we've been able to get a hold of the rapid antigen test, and I
Mm-hmm.
know that that's not absolute definitive, but it is fast. Do you want any testing that we do with the antigen test reported to the health department?
Yes, all of the testing should be reported, and if you can let me know if you can send me what lab that you guys are using, or if it's just your own stuff, so that way we can make sure that it's accounted for in the state system for the testing. So you guys are doing the rapid testing now at Encompass?
Well, it's the antigen test, so it's not the
Yes.
it's
Okay.
testing for the antibodies, presence of the antibodies.
Okay. Okay. I wasn't aware that you guys were doing that. But
We just
I
got
can
it
double
yesterday.
check. Yeah. Okay. Well, we can definitely talk offline and figure out how they want those accounted for. Because I know a lot of people have been asking about that too, to see, if they do have the antibodies and that kind of thing. So is that something you're just going to be doing for your patients?
Mostly that would be what it'd be for, yes.
Okay.
I've got a
Another
question. Can you hear me?
Oh, go ahead, Beverly.
I'm supposed to be driving to Charlotte on Saturday to look after my grandchildren as my daughter-in-law returns to work. And I'm just sort of worried about being stopped or that's my main worry. If I'm going to get in any sort of trouble, I've been self-isolating here. I will self-isolate there, but it's the in-between bit. I know I'm going to have difficulty with restrooms, but that doesn't worry me as much as I go through about 2 or 3 different states at least to get there. Is there any advice? I'm not really sure what's what.
I mean, you would have to check and see what each individual state is doing. I can only talk about what the state of Florida is doing. I'm not sure what the other states are doing.
Well, it sounds, I did Google something. It sounds as if, as long as I haven't come from New York, Connecticut, or Louisiana, it's okay. But what is Florida doing for the first part of my journey, or what might they do?
That's what the state of Florida is doing. Is persons that are coming in from those states are being asked to come in and self-isolate. I'm not sure what the other states are doing, so that wherever you're traveling to, you'd have to check and see what those states are doing.
I think it's the same or less, actually. So that I should be all right. Yeah. Okay. Thank you.
Hey, Heather, we got a couple more questions. Go ahead.
This is Don Sermons, Heather. Again, thank you for your presentation. 2 things. One, Bev, I had to go to Jacksonville this weekend for my treatment over at Mayo, and I had no problems on the interstate. As a matter of fact, it was eerie. There's mostly trucks on the interstate, very few cars, and no troopers were out, and the speed limit was disregarded completely. But there was no problem going back and forth. And
so there'll be trucks around me going at 100 plus miles an hour, but apart from that,
and the restroom area and all that thing, just take care of that. But Heather, my question to you is there any follow-up on a person that's confirmed with the virus as to their contacts? Is there a program in place that, I know you're prohibited from releasing names and things like that, probably from medical laws, HEPA or whatever. And but is there a way that somebody's contacting individuals that may have had contact and not know the person is
right? So those persons that are considered close contact, which has been around, are moderate to high risk, which that's people that they've been in contact with for a prolonged period of time within less than 6 feet. So that's the 15 to 20 minutes is the approximate time. But the people, whenever epidemiologists get a new case, they reach out to that person who's confirmed and ask them, all the places they've been, all the people that they've been encountered with, and they do reach out to those persons that are, like I said, have been those close contacts, and those people are advised to self-isolate for 14 days and monitor for any symptoms that they may have.
Oh, thank you.
I see a couple other questions in the chat too. Go ahead.
Yes. The first one is of the 25 cases confirmed in Bay County, do we have stats on them such as an average age? Do they have underlying health issues, etc.? And the second part of the question, next question is, what hospital in our city area is treating patients?
So on the first question, that information is available. I was trying to get it to pull up. For some reason, it's not pulling up for me. It's available at floridahealthcovid19.gov as far as the average ages and things. We can't discuss the underlying health issues. As a broad message, I can tell you that across the state of Florida, that a lot of them have had diabetes. It's been one of the biggest issues across the state of Florida, and they are working on some additional messaging for persons with diabetes. You know, of course, a lot of times with diabetes co-occurring, you have heart disease, you know, asthma. Those are the three biggest ones that they're discussing across the state as a statewide underlying health issues. And as far as which hospitals are treating in Panama City, we cannot answer that question either. These are not only protected by HIPAA, it's also Florida statutes and Florida codes that we follow as well.
Okay, thank you. Any other questions, Heather? If not, please join me in giving, hold on. Has there been any cases of community spread?
Well, we've had cases, I mean, basically what we've been told is that there's community spread throughout the state of Florida. We've had cases that are not travel, they're not contact. So, I mean, it's likely that has happened from what we have seen and experienced. So that at some point, some of those people have had to been in contact with someone that maybe didn't know they had COVID-19, or they didn't know that they were in contact with someone that had it. So, you know, we are seeing that throughout the state of Florida.
Okay, excellent. My fellow Rotarians and guests, please join me in giving Heather a big round of applause. Heather, thank you very much.
Thank you. Appreciate you, Charles.
Thank you. Now, Jan, do you have any comments for us?
Had to unmute. So I, like everyone else, thank you so much, Heather, for the informative presentation this morning. Just a quick heads up to particularly presidents-elect and maybe grants chairs from the various clubs. We are revising the district timetable as well as the procedures for this year. So communication will be going out, I believe, this week on that. So be on the lookout for that. It's going to offer clubs a lot more flexibility and be able to address COVID-19. So we're in a state of flux. The deadline of April 30th is out the window. So anyhow, just be on the lookout for that information to come up. You'll have a little bit more time to be able to come up with a plan for really working in your community to help with the situations that are going on. So that's all I've got.
Jan, thank you very much. Is there anything for the good of the order? Anything for the good of the order?
Actually, next week we have Lori Allen from Gulf Coast Children's Advocacy Center will be our guest speaker.
Okay, thank you. And Andre, I think there was one question about information about Zoom being sent out. So that information will be sent out to everyone. And then it's also my understanding, Andre, that a recording of today's Zoom session will be available.
It will be available. Give me till tomorrow because I have to download it and edit it to take some of the stuff out. And now Bob Micah from last week is available. Just and I can post that. I can send that out via DAC-DB. And I want to address the question about Zoom and safety. Please note that everybody had to. I had to admit everybody into our meeting today, and I recognize 99% of you. Well, all you guys. So that's it.
Oh, I would like to say, that even though we have COVID, it's still Easter. So I'd like to wish you all a blessed resurrection celebration.
Thank you, Dr. Dale.
Thank you, Doc.
Yeah, Dr. Dale, thank you for saying that. Happy Easter to everyone, and do everything possible to keep yourselves, your family, and friends COVID-19 free. And I look forward to seeing everyone next week on our Zoom call. Thank you all very much, and God bless you. Happy Easter.
Happy Easter.
Bye-bye.
Okay.